average duration that somebody with COPD spends in a hospital with an attack is probably around 5 days.
COPD is a progressive lung disease described as a mixture of asthma, emphysema, and chronic bronchitis. People with advanced disease struggle to breathe. It's a top cause of hospital stays.
It is a very high cause of hospital admissions. The chances of dying from this, from developing respiratory failure, are very high.
Brought on by inflammation from inhaling irritants like cigarette smoke, the lungs become tight. Nationally, between 20 and 24% of hospitalized patients will be back within 30 days.
Once they're in the hospital, they're away from the smoke, they're getting all of their medicines, they feel better, they go home. Unfortunately, they re-enter the same environment again.
To stop the cycle, experts looked outside the hospital and into the home, transitioning patients into a COPD management program based on each person's need.
We discovered that some patients had oxygen tubing that would be 50, 75 foot, which means the patient wasn't getting any of the oxygen. They weren't using their medication correctly.
Over a period of weeks, discharged patients are taught to use their equipment, monitor medication, and conserve energy. And they're left with detailed instructions.
It actually goes on the refrigerator. And if you notice the colors, it's green, yellow, and red.
Taking the time to teach helped drop the readmission rate down to 7 or 8%.
What prompted us to take the initiative for this program was to identify what are the barriers causing them to be readmitted and what can we do to help them.
For Lee Memorial Health System, I'm Amy Osher.